Oftentimes, even the most aggressive weight loss and exercise programs cannot eliminate unsightly bulges from the body. Dr. Sanders utilizes the advanced techniques of Tumescent and Ultrasonic assisted liposuction to contour a shapely body as he removes fat cells in the hips, thighs, buttocks, and other areas. The results are dramatically noticeable with minimal recovery time. Additionally, we all desire a flat tummy, but age, childbearing, and weight gain can cause a protruding stomach or loose skin. Dr. Sanders performs a tummy tuck procedure known as abdominoplasty to remove excess skin, fat, and often stretch marks from the abdomen. He can also tighten the abdominal muscles if necessary. Dr. Sanders' contouring methods can literally enhance your natural curves to create a more balanced, proportional figure.
Liposuction is the most popular cosmetic procedure in the world, and it is that because it changes your shape in a relatively permanent way. Whenever a person has bulges of fat in a particular area, as you once did in the tummy and hips, where we did some liposuctioning, and now you have a beautiful figure. But when you have a bulge in those areas, it's because there are too many fat cells present. It's not that your fat cells are any larger there than they are somewhere else. There are just too many of them. With liposuction, we actually suction fat cells away, and when they are removed, they never regrow unless you gain a great deal of weight or go through menopause, something of that type. So your number of fat cells is decreased permanently. If you gain weight after liposuction, the fat cells will plump up, or so will those in the surrounding areas, so your shape really doesn't change. Now when we do liposuction, in your particular case, we use the microliposuction technique with very tiny suction tubes so that you had tiny scars that we can't see to this day. Also, it allows us to avoid any waviness of the skin, which we were able to do in your case as well. There are other options available, such as the ultrasonic assisted liposuction technique that involves an ultrasonically energized suction tube that will melt the fat. But depending upon your needs, we've got all of these available, and in your particular case, we chose the microliposuction technique. Now, when liposuction is done, it only removes fat, and that was all you needed. But in certain cases, after pregnancy or after a significant amount of weight loss, there's going to be loose skin, there's going to be loose muscle, and that can be very, very nicely corrected by means of a tummy tuck. When a person becomes pregnant, the two large muscles running up and down in the abdominal area tend to stretch apart. And when that happens, it doesn't matter how much you exercise, you're never going to have a flat tummy. Sure, the muscles are strong, but the internal organs are going to bulge out, and you're still going to have a lower abdominal bulge regardless of the number of crunches that you do. The same goes for skin. You cannot tighten skin by exercise, nor can you get rid of stretch marks with exercise. So we rely on a tummy tuck. A low incision, we lift the skin, release the belly button, lift the skin up to the rib cage, and then tighten the muscle all the way down. We then remove the skin and fat at the bottom, so we bring the point just above the belly button all the way down. We then bring the belly button out at its new location, do some liposuction in the hip and the pubic area, and that gives an outstanding result. Now that's the more traditional tummy tuck. We're also able to do what we call a mini tuck, where there's a very limited incision. We don't do as much, but many patients don't need to have as much done. So whether it be a traditional tummy tuck or whether it be a mini tuck, we can achieve a significant improvement in the abdomen for virtually any woman who's coming to see us.
Additionally, Dr. Sanders can perform a thigh lift and an arm lift. These procedures can be performed separately or in conjunction with sculpting other areas of the body.
I've got grown children, and of course I had that little pouch on my tummy, so I decided to have a tummy tuck. I've got a wonderfully flat tummy now, and I love it. My clothes fit better, and I'm really happy with the way they look.
I decided to have a tummy tuck because I had a lot of extra skin around my abdomen. I had gained and lost weight a number of times, and I just couldn't lose it.
I had twins 14 years ago, and my abdomen was stretched out, the muscles were damaged, and I had a big piece of fat that hung over my C-section scar. And I could work out and do 100 sit-ups twice a day, and I could not get results. I was just really discouraged, and I knew that a tummy tuck was probably what I needed, but I was hesitant because I don't really jump into things very easily. But after 14 years and my boys are getting grown up, I thought, I don't want to live my life this way. I want to have something done. Had a consultation and decided to do it with Dr. Sanders.
After having 4 large children and a 50-pound weight loss, it just really took its toll on my body, and so I decided to have a tummy tuck and a breast lift and breast augmentation to try to, you know, bring back the body I had before I had my children. And my husband, having a 100-pound weight loss, had extra skin and also wanted to improve his body, so he and I came to Dr. Sanders together.
Actually, I'm the one that had 4 large children. It wasn't her. No. It feels like it sometimes, but we had both decided. I had noticed with my wife that she just was not happy with her appearance, and it's very important to make sure that your wife feels good about herself. And so we decided to come here together, and both very nervous. We were referred by a friend of ours that had told us about how great Dr. Sanders was, and we came in, and he just made us feel very much at ease. After that, we'd come to another consultation, and he just really got to know us on a personal basis.